So continuing with our lecture, we're going to go ahead and start with chapter 10, which involves change. So perceptions of change. What do you think of change? It's a natural phenomenon. There's macro and micro change. So on the macro level, which is a large scale, changes affect the healthcare system in a large aspect, and each healthcare organization constantly. It's continuous. Whereas at micro level, there's a small scale change, and when changes occur in a system, there's usually a ripple effect to nursing units and team members. So the impact of change may be local, confined to one nursing unit organization wide, or it may be smaller, sweeping. It also may occur gradually or rapidly. So on this next image, it's the change process, which shows three basic stages described by Kurt Lewin. He's a gentleman who created this in 1951, which he describes the unfreezing stage as the comfort zone, where it involves actions that create readiness to change. You gather data, figure out what the resistance might be. And then the change stage is where there's the discomfort zone. There's lots of planning, and then there's also you realize where the help is needed and where to give support. This is also the implementation phase, the actions that are needed to put the change into effect. And then the last stage is the refreezing phase, where you get the new comfort zone and you're restabilizing, sort of, more or less. This is the phase where the changes occurred, changes were made, and it becomes a regular part of everyday functions. So also in the refreezing phase, you want to ensure that your team members have moved to a new comfort zone. So you want to ask them questions, and key questions to ask yourself is the change well integrated into day-to-day operations and routines? Is it working well for team members? Are team members comfortable with this change? Is the change well accepted? Is there any residual that may undermine what you implemented? So receptivity to change, there's a preference for certainty, which is helping teams recognize their preference for certainty or proven approaches as opposed to change, which will hopefully increase their receptivity to necessary changes in the workplace. And then also they're speaking to people's feelings, where you can tell a compelling story surrounding the reason for change. And this will increase receptivity to change more than just a carefully crafted analysis of the need for change. So there's more sense of urgency when it comes to that. So resistance to change. What are some main resistance issues? Think what stops us or prevents us from changing. So sources of resistance include technical concerns. The change itself may have design flaws and may be based on concerns about whether or not it's a good idea. Relation to personal needs. Think about the hierarchy of needs. It may threaten safety and security needs. Change requires risks to be taken. It can create anxiety related to fear of what they might lose. Threats to a person's position and power. So once you have that status, power and influence can be hard to relinquish. Resistance can happen due to staff feeling less important. A core competency of change is to strengthen and shape the nursing profession for now and the future. Other sources of resistance include perceptual issues, where the person doesn't understand there's a problem. They feel everything is fine the way it is. Time. Will it increase the work, thus decreasing available time to do the job? Fear and biases of the unknown. Often this is due to a person not understanding. There's a lack of education. This is the most common reason for resistance. It's a lack of staff input and participation. So you want change that is directed more so people participate, and those that don't participate tend to experience more resistance. And then there's an economic threat too. Is there going to be a job change or job loss? And then also a social threat, which means that there could be issues with the social structure and how the environment changes as well. So recognizing resistance. So to unfreeze the staff from the current status, staff needs to be motivated to change. They begin to feel a need for change, thus increasing motivation for change. Gain staff support and agreement about the need for change. Develop a task force with this group. This will bring the staff on board, discuss ideas, and begin planning. Discuss what the vision for change is and how it will relate to the staff. Keep it simple and realistic. Have multiple methods to initiate the change, multiple discussions, and repeat the information. Make everyone feel as if they have participated. Change may take a long time, but provide short-term wins. Those can make participants feel as if progress is being made. This builds morale and sense of success. Continue to ensure changes are being valued and utilized. Evaluate, monitor, and adjust as needed. Before we can truly begin to promote change, we must first determine and find out if there's evidence to support our change. Communicating the vision, motivating team members, involving team members in decisions that affect them, dealing with conflict, eliciting cooperation, providing coordination, and fostering teamwork. All right, dictating change. So this type of change involves people in authoritarian roles requiring staff to make changes with what they're doing. This can lead to a passive, dependent, unmotivated, and unempowered staff. It can be effective in many situations where rapid change is needed. You can communicate a sense of urgency this way, but the change may be so rapid and it also may not have a lasting commitment. So in this figure or table, it shows resistance to change, whether it's active or passive resistance. So active resistance would be a person attacking the idea, refusing to change, arguing against the change, organizing resistance of other people. And passive resistance is where they're avoiding the discussion, ignoring the change, refusing to commit to the change, and agreeing but not acting. Strategies to overcome resistance. Point out similarities, express approval, recognize competence and skill, and provide assurance. Also, suggest new opportunities, express a value of contributions, ensure involvement, provide opportunities for expression, allow time for practice, provide a climate of acceptance. There's also 4 phases of a plan change that include design the change, plan the implementation, implement the change, and then integrate the change. So what is the purpose? Is the change necessary? Is the change technically correct? Will this work? Is there a better way? Encourage people to talk about the changes planned, to express their doubts, and to provide their input. Those who provide their input are usually enthusiastic supporters later in the process. Plan the implementation. So almost everything you've learned about effective leadership is useful in planning the implementation of change. Communicate the vision, motivate people, involving people in decisions that affect them, dealing with conflict, eliciting cooperation, providing coordination, and fostering teamwork. So implement the change. Ask yourself these questions with implementing change. What is the magnitude? What is the complexity? What is the pace? And what is the current stress level? Consider the following factors. Magnitude. Is it a major change that affects almost everything people do, or is it minor? Complexity. Is this a difficult change to make? Does it require new knowledge and skills? Pace. How urgent is this change? Is it a gradual change or must it be implemented immediately? Stress. Is this the only change that is taking place? How stressful are these changes, and how can people keep their stress at tolerable levels? Ask yourself these questions too. Is the change integrated into everyday operations? Are people comfortable with it? Is it well accepted? This is the rephrasing phase of change. After change has been made, make sure everyone has moved into the new comfort zone. In conclusion, in order to lead change, you have to be willing to change yourself. Recognize the need for change, then learn how to do things differently, and then become comfortable with the new you. Change is an inevitable part of living and working. Good leadership can influence how change is accepted. So I wanted to just add on a little bit about the Quality Improvement Project and requirements. Please refer to the 2 Nursing 300 rubrics on the QI project in the syllabus and on Moodle, where there's 2 rubrics, the presentation one and then the written paper rubric. Your group project, so hopefully by the time you listen to this lecture, you'll know what the group project is. The percent of course grade, I believe, is 30%. If that changes, I'll let you know. It should also be in the syllabus as well, and then on the grading rubric. And then due date, so our presentation is Monday, November 18th from 12 to 3 p.m. In the Riverside Regional Annex D conference room, and then the written papers will be due November 26th by 8 a.m. in the Moodle Dropbox. If you have any